Today, we are going to talk about a very serious disease that actually recently broke out in the country, that is the Ebola virus disease. Many of us have heard about the disease, but do not truly understand what it is, how it's spread, and how it can be prevented. And that is why today we are joined by Dr. Mahad, a medical personnel and a representative from Healthy Beginnings Uganda, that is going to give us extensive information about the disease to know how we can protect ourselves, our families, and our communities. You are welcome, Dr. Mahad.
Thank you so much, Elizabeth.
Yes, we would like to know, I and the viewers, what is Ebola?
Ebola, like any other viruses, this is a disease which is caused by Ebola virus, and it was first discovered in 1976 near Ebola River in what is called now Democratic Republic of Congo. Yes.
So from what I'm getting to know is that this disease has been amongst us from time to time from over 40 years ago. And my question is today, how is this disease spread?
So many people think Ebola spreads within air, which is not true. The disease can be spread through contact with an infected individual's fluids. That will include the vomitus, the saliva, the tears, the urine, semen, vaginal fluids, and stool. And this can actually affect people of all ages if control measures are not taken into control. Ebola is only spread through contact with an infected individual. So there's no other way up. For example, if an individual shares contaminated clothes of an individual who is infected, and one can get Ebola. If you get into contact with infected animals, wild animals, you can also get Ebola. And getting in close connection with the people who are already infected and sharing their fluids, basically, that I mentioned earlier. That is how basically you can get that condition.
Oh, thank you for that. I would also like to know, since you mentioned that everyone could be a person that gets Ebola as a disease, who is most at risk of getting this disease?
The individuals who are at risk of getting this condition basically in 4 categories, if we are to break them down. We have family members who take care of an infected individual. And then the health workers who do not have good protective gears against the condition, people who get into contact with already infected wild animals, and the people who get to bury an infected individual. That's why the ministry and other regulatory bodies tend to put up regulations on how such should be handled. Yes.
We would also like to know what are the symptoms that get to manifest in a person, and also how long does it take for this particular disease to show after someone getting affected?
So the symptoms tend to come out within 2 to 21 days, and this will depend on someone's immunity, it being a virus. So there are those first symptoms that come out within that range of the window period of 2 to 21 days. And some individuals tend to present with malaria-like symptoms. That's when you get to hear an individual going to the hospital and then they say they checked me for malaria and all tests came out negative. But an individual will come presenting with general body weakness and pains, shortness of breath, fevers, a sudden headache, and maybe a sore throat when the disease has just started. But as the disease progresses, the symptoms also aggravate. That's when you get to see an individual saying, I'm having an abdominal pain, they are vomiting, they are having diarrhea and painful swallowing. Then later, as the disease tends to progress, then also symptoms tend to progress. And then some individuals tend to get internal bleeding. They get to bleed within all the openings of the body, the eyes, the gums, the mouth, the ears. So that's when you get to see some individuals tending to die if not managed promptly.
Yes. Doctor, talking about these symptoms, I've heard you mention the fevers, the abdominal pain, and a number of people that actually come to these medical facilities are advised on some of the things that they get to experience over time. When people get to know that they have not found these, let's say, malaria, typhoid, because those are the common diseases the layman knows, people tend to drive at, I've had I've gotten people bewitching me. They're like, okay, different narratives that people have. It is quite sad, at some point saddening, because people don't wait for medical attention from the required personnel. I would like to know, how is one diagnosed?
So diagnosis does not basically depend on the symptoms only, because when you look at these symptoms, these are vague symptoms that can fall in different conditions. So we correlate the conditions and special medical tests that are done, or laboratory tests that are done. So we correlate the tests that are specialized with the symptoms for us to come up with the diagnosis of a symptom, a condition of Ebola. But when an individual is identified to be having such symptoms, and then you do all the tests that are not correlating to any condition, then with a history of exposure to an individual with Ebola, so isolation of an individual will always be the first priority. Because that way, if an individual is isolated in a gazetted area by the ministry or the government, that will require tests to be done and then come up with a clear diagnosis. Yes.
We would like to know, is Ebola treatable? And if treatable, how can one have it cured?
So Ebola is a very treatable condition. Normally, promptive, supportive treatment given on time will help someone get better and improve faster. So some of the treatment we give is not specific in this case, because being a virus, normally there are no specific treatments for viruses, but then we manage according to the severity of the symptoms. Like we earlier said, some of these individuals get severely dehydrated due to vomiting and diarrhea. So we give IV fluids when they're in their isolation areas. We give IV fluids. And for an individual who is having shortness of breath, we consider an oxygen therapy. We give supportive treatment, supplements to boost the immunity. We also allow these individuals, we also manage some of the other conditions they could be having, because some individuals die faster based on the conditions, the comorbidities they have. So if all those comorbidities are also managed, and then someone is given treatment monitored, the vitals are monitored promptly, someone will be able to improve and heal faster.
Oh, thank you so much, Doctor. That is really informative. Over time, growing up, through the different community health engagements, we've been told by doctors, prevention is better than cure. Prevention is better than cure. And here today, we have you, since we are talking about this deadly disease, how can a person prevent getting Ebola?
So not forgetting, prevention is the most powerful weapon against Ebola. So in this case, we always follow what the guidelines that are put up by the ministry. You should always wash your hands regularly and promptly with clean water and soap. Avoid contact with blood and fluids of an infected individual. Do not touch bodies of people that just died or wild animals without any known cause. Avoid handling sick people and dead bodies at any one moment. Knowing that Ebola is a deadly condition, if you get any symptoms that do not correlate to any condition, please try to seek medical attention and treatment as soon as possible. So that way we are able to prevent the progress of the disease.
Thank you so much, Doctor. Doctor, we would like for you to give us a take home as the community, as the families out there, because looking at you being a medical personnel, we are looking at healthy lives.
You should all know that Ebola is a preventable but a deadly condition. Knowing what it does, how it is spread, how it is prevented, and how best you can be able to seek medical attention. If you ever develop any symptoms that do not correlate to any condition, please take yourself to the facility that you feel will be able to handle you. Do not take it that is malaria, which is not going without any laboratory diagnosis. And to the health workers out there, if you test any individual, please check their history of travels. Are they in any connection of the individuals or from any areas that are already gazetted for Ebola, please, if you realize this happening, allow these individuals to meet to gazetted areas by the government for prompt treatment. So thank you so much for listening from us, and may God to continue blessing you.
Yeah, thank you so much, Doctor, once again. And as I close off, I would like to say, please make sure this message reaches a larger crowd, and you can like, comment, or even send this message out there. For people that are looking out for the best health services around Gayaza, Manyangwa, Chijabijo, please reach out to Rangers Medical Center, because your health is our priority. My name is Elizabeth, and we are working with Twahira Shots. Thank you.